welcome back to the channel. Thank you for your support. Every like, comment, and share helps us spread clear and reliable awareness about psychology and mental health. Please remember, this video is for educational purposes only and not a medical diagnosis. Avoid self-diagnosing, and if you or someone you know may be experiencing symptoms of OCD, seek guidance from a qualified mental health professional. With that said, let's begin. What is OCD? Obsessive-Compulsive Disorder, commonly known as OCD, is a mental health condition marked by persistent, unwanted thoughts or mental images, known as obsessions. These obsessions often create anxiety or distress, which then leads to repetitive behaviors or mental actions called compulsions. OCD is not a personality trait or a harmless habit. It is a serious condition that can cause significant emotional suffering and interfere with daily life. What many people don't realize is that OCD can appear in different forms. To better understand it, let's explore 4 common ways OCD can present itself. Type 1. Intrusive thoughts and rumination. Everyone experiences uncomfortable thoughts from time to time. A strange or disturbing idea may pop into your head and you simply move on. With OCD, it's very different. Intrusive thoughts are repetitive, persistent, and hard to ignore. They don't pass quickly, instead. They can replay in the mind for minutes, hours, or even longer. These thoughts can focus on many themes, such as fears of harming oneself or loved ones, unwanted sexual thoughts or doubts about one's identity, religious fears or concerns about committing sins, constantly analyzing relationships, magical thinking, believing that thinking about something could cause it to happen. These thoughts often lead to compulsive actions or mental rituals meant to neutralize fear or reassure oneself. Ruminations are slightly different. Ruminating involves obsessively thinking about a question or idea that has no clear answer. Instead of resisting the thought, the person becomes trapped in it. For example, someone may endlessly think about life after death, imagining every possible outcome in detail. This can make them feel mentally detached from the present moment and deeply absorbed in their own thoughts. Type 2. Checking behaviors. Another common form of OCD involves repeated checking. This usually stems from fear that something terrible might happen. Examples include constantly checking doors, stoves, or appliances, repeatedly asking loved ones for reassurance, reviewing memories to make sure no harm was caused. In some cases, checking can be internal. For instance, a person who struggles with intrusive doubts about their sexuality may monitor their body's reactions, looking for proof one way or another. Ironically, intense focus can trigger physical responses that increase anxiety rather than reduce it. This happens because the body often reacts to what feels relevant, not necessarily what aligns with our values or intentions. Another example is repeatedly rereading an email before sending it, worrying that a single word could offend someone or cause serious consequences, like losing a job. While these fears may appear irrational from the outside, they're often rooted in something deeply valued. People with OCD usually perform these compulsions to protect what matters most to them. Unfortunately, OCD has a way of attaching itself to whatever a person loves, turning that value into a source of fear. Type 3. Contamination and mental contamination. Contamination-related OCD generally falls into 2 categories. Physical contamination involves intense fear of germs, dirt, or illness. This may cause someone to avoid contact with others, wash their hands excessively, or repeatedly clean themselves to feel safe or clean enough. Over time, these behaviors can cause real physical harm to the skin and body. Mental contamination, on the other hand, is less visible. This can happen when someone feels emotionally violated, for example, after being insulted, mistreated, or verbally abused. The person may feel internally dirty and try to wash away the discomfort through compulsive behaviors like showering or repeated cleansing rituals. Research on mental contamination is still developing, but it's an important and real experience for many people with OCD. Type 4. Symmetry and order. This form of OCD is often misunderstood. It can involve needing objects to be perfectly aligned, organizing items until they feel just right, folding clothes or arranging spaces in a very specific way. While many people enjoy neatness, OCD-related symmetry is driven by discomfort, not satisfaction. Even when things appear tidy to others, the person may feel a strong internal sense that something is wrong. They logically know things are fine, but emotionally, the feeling won't go away. This discomfort can persist throughout the day, pushing the individual to repeat the behavior again and again. And even then, the relief is usually brief, sometimes lasting only a moment before the cycle starts again. The OCD cycle. OCD often traps people in a loop. Obsession gives anxiety, gives compulsion, gives temporary relief, gives obsession again. The goal of the compulsion is not pleasure, it's simply to escape fear, even if only for a second. Hope and treatment. The good news is that help is available. Many therapists specialize in treating OCD and understand its complexity. Some individuals experience meaningful improvement through evidence-based treatments, like cognitive behavioral therapy when guided by trained professionals. If you believe OCD may be affecting you or someone you care about, seeking professional support can be an important first step. Do you feel like you understand OCD a bit better now? Thank you for taking the time to learn more about mental health with us. If you found this video helpful, feel free to share your thoughts in the comments and connect with others who may be experiencing something similar. You're not alone. Support, understanding, and awareness can make a real difference. If this content helped you, consider liking the video and sharing it with someone who might benefit. Subscribe for more educational psychology content, and thank you for watching.